The approach I take with the root cause testing in my program is pretty individualized in that, especially being a functional diagnostic nutrition practitioner, we have a lot of different potential root cause tests we could choose from that give us different data points that we can help rule in or rule out possibilities that we can see that link with symptoms in clients. And so the way I kind of assess my clients in the beginning is, some of it is just subjective assessment, like, okay, how are you rating these symptoms? I use a tool called the Nutrition Assessment Questionnaire, which actually goes back to my nutrition therapy days, and then also asks a lot of questions about just their home, what do they know about the age of their home, stress points or stress levels, their relationships, just a lot of kind of like whole person centric data to form a really good impression as to what I think might be some possible root cause things driving the whole symptom picture. And I will say, because I serve mostly people with gut issues, whether that's IBS or something more serious like on the IBD spectrum, we're always going to do a really good stool test, right? And of course, different than what the doctor would run, as we were kind of talking about earlier. So that's kind of like non-negotiable, always one of the tests I run on all of my gut clients. Now, beyond that, it can kind of vary depending on the other components of what's going on with them. So in certain cases, I might want to actually look at different hormone balances that might be related to having, stress levels that are not in balance, right? I'm going to use very simple terms here, so it's hopefully pretty understandable. But, we can actually look at stress hormone profiles through certain testing. We can look at sex hormone profiles that can give us a lot of information about the health of the nervous system, and also a little bit of insight into maybe what may be going on with the immune system, because we know if the immune system's out of whack, we're often going to see stress hormones out of whack as well, and sex hormones out of whack. I will sometimes look at thyroid as well, because that can actually secondarily either get impacted by longstanding gut issues, especially if there's absorption issues or problems with, say, like liver function. The liver is where, thyroid hormone needs to convert into its active form. And so if thyroid gets out of whack, either typically what we see is, thyroid function kind of going down. We call that hypothyroid, right? Or functionally low thyroid function. That can impact, not only just how well can that person make digestive fluids like stomach acid and enzymes, but also the motility through the gut, which of course could be directly correlated with different gut symptoms, whether that's diarrhea, constipation, right? So that's a big piece of it in certain cases. Other testing I will sometimes do will look at.
Thanks for watching this video, and you can find the full-length podcast episode here on this channel, or you can head over to Apple Podcast or Spotify, and don't forget to like this video.